in front of me, I have an adult human skeleton, and I would like to address the important points that you need to know for airway management. First of all, here we have the skull. At the top, we have the upper jaw, which is known as the maxilla, and at the bottom, we have the lower jaw, which is known as the mandible. Some important points of the mandible: here we have the base of the mandible, here we have the body of the mandible, and here we have the ramus of the mandible. And this portion is especially important for us when we're going to perform the jaw thrust, because your fingers are going to go on the ascending rami in order to lift the jaw to the ceiling. Now, below the skull, we have the cervical vertebra. The first part is C1, which is known as the atlas. And atlas is, as you guys know, like the atlas that supports the globe. So C1 supports the head, and below that we have the C2, which is the axis, which rotates the head side to side. And when we're performing the triple airway maneuver, as the Peter Safar would call it, you're going to essentially open the head tilt with extension of the atlanto-occipital joint, which is the articulation of the base of the skull with C1, right? And this is, again, the patient who does not have a cervical spine injury, so we extend the head back. The next portion of the maneuver is you're going to take your index fingers, go under the ascending rami, and you're going to lift the jaw so that the lower teeth are in front of the upper teeth. This is how we know it's effective jaw thrust, when the lower teeth are now in front of the upper teeth. And I'm using my thumbs now to facilitate opening of the mouth. So all of these three things together: extension of the atlanto-occipital joint, elevation of the mandible so that the lower jaw are in front of the upper jaw, and opening of the jaw with your thumbs is known as the triple airway maneuver. Now, the next thing I'd like to show is how do we size an OPA. And based on the study that I demonstrated here, the proper technique was essentially from the central incisors to the angle of the mandible, this portion here. So I have two OPAs here. The first one from the central incisors to the angle of the mandible, and you see how it's much bigger, right? It goes past my angle. So this would be the wrong size to employ. If I use this OPA, in order from the central incisors to the angle of the mandible, this would be the appropriate size for this patient to employ.